episode of the Brain Tumors 101, we will talk about acoustic schwannomas in this video. So what are the acoustic schwannomas? Generally speaking, they are benign and slow-growing tumors arising from the Schwann cells of the 8th cranial nerve, also known as the acoustic or vestibulocochlear nerve. This cranial nerve is very important as it transmits information to the brain by hearing, and of course the vestibular part which takes care of our balance. Now, acoustic neuromas account for about 8% of all primary brain tumors. This means that they typically occur in middle-aged adults, and females are twice as likely as males to have this tumor. Now, the usual location of an acoustic neuroma is usually located where the angle between the cerebellum and the pons will be. So this is in the back of the skull or in the posterior fossa. Now, to be able to remember it well, so you have to touch the one behind your ear, right? So the part is where the temporal bone will be and the mastoid part. So that will be the part where our surgeons will usually incise in order to access the neuroma or the schwannoma, okay? Although an acoustic neuroma does not spread to other parts of the body and usually grows slowly, as we have said, it can cause a lot of symptoms that we will talk later. Now, what are the risk factors of developing schwannoma? So, a while ago, we have said that it is typically occurring among middle-aged adults, and females are twice as likely as males to have this tumor. And also, it have been linked to a genetic disorder called neurofibromatosis type 2. But take note that 95% of these tumors will occur spontaneously without any evidence of family history. Now, what are the signs and symptoms of an acoustic neuroma? So once again, the location of the tumor itself will largely dictate the clinical signs and symptoms of the brain tumor mass. Most commonly, it will cause one-sided hearing loss associated with buzzing or ringing in the ear, as also called tinnitus. It can also be associated with dizziness. Now, if the tumor will affect or compress the facial nerve nearby the 8th nerve, facial paralysis may also occur. Other important symptoms include difficulty in swallowing, impaired eye movement, taste disturbances, and problems with balance. Now, again, I would like to emphasize that in order to confirm our diagnosis of an acoustic neuroma, we have to undergo diagnostic tests by a medical professional. Now, how are acoustic neuromas diagnosed? A vestibular neuroma or acoustic neuroma diagnosis is difficult to detect early on because symptoms usually develop gradually and can resemble those of other middle and inner ear problems. The following, like hearing tests, balance tests, and CT or MRI scans, are used in order to diagnose acoustic neuroma. So how do we treat acoustic neuromas? If the neuroma is very small or if it's not causing any symptoms, then we can observe it with serial MRIs. It will largely depend on your physician whether they will ask you to come back twice in a year or annually, depending on how well or how severe your symptoms will be. Now, if the tumor is larger and symptomatic, it should be treated with surgery or SRS, or what we call the stereotactic surgery. Now, of course, every patient are different. The optimal treatment will always depend on the size of the tumor, the symptoms, and the patient's preference. Always remember that the physician and the patient will have to work together in order to provide the best management for our brain tumor survivor. Thank you once again for listening to the Brain Tumors 101 by PGI Castro. I hope you learned a lot in this video, and may we see you next time.